Okay, so your virtual lab today, I want to go over septic and aseptic technique. So what is the difference? When do we use aseptic technique or sterile technique? So we want to use aseptic anytime that we are coming in contact with another person's body fluids, blood, anything like that. Okay, wounds it would be one that you would need to wear gloves. So, and also, are you cleaning the patient's site whenever you're doing an injection or a venipuncture? Certain things require soap and water. Certain things require just alcohol wipe, and certain things will require maybe a little more expensive, such as betadine or an aseptic microbial antibacterial cleanser. So how do we prevent infection? Your number one is going to be hand washing, right? So what is the difference? Can one of you tell me what is the difference between a technique and just your regular clean technique? What's the difference? Anybody?
Are we unmuted?
Oh yeah, you're unmuted. I forgot to mute.
What was the question?
The difference between aseptic technique and just regular clean technique.
I don't know the answer, but is this spelled ASEPTIC?
Yes.
Okay. Okay.
Yes.
I think the difference would be one of them's a lot more thorough, and a clean technique is like a venipuncture, and aseptic technique more like if Miss Lois cut her arm open and we had to treat it. All right. Sorry.
Okay. Okay. All right. So let's go over a couple of things. And then your lab assignment, we're going to go over at the end. There is something that I want to show you, and then that will be your homework and lab assignment combined for today. So medical asepsis. Medical asepsis is, and it's ASEPSIS, asepsis. Asepsis means practices that minimize or eliminate organisms that can cause infection and disease. There are two types of asepsis, medical and surgical. Medical asepsis refers to the practice of reducing the number of microorganisms from one person or source to another. It is also referred to as clean technique. So it's theoretically the same, okay? So then you have, what is the number one, and I know you all know this or should know this, what is the number one thing that you can do to protect yourself and your patients of disease transmission?
Gloves.
Who said gloves?
I did.
Okay.
Is it washing your hands?
Washing your hands.
Yeah, number one.
Yes, washing your hands. Okay. So, hand washing. Did you know that there is a certain way to properly wash your hands? How many seconds do you need to accurately wash your hands?
25.
25? Lois? 30?
30.
Okay. If If you're not able to wash your hands, what else can you do? If your hands are not visibly soiled, if they do not have body fluids on them, feces, wound drainage, if they are not visibly soiled, and you are going from one patient to the next patient, and you are not able to wash your hands, what can you do?
Hand sanitize.
Hand sanitizer, yes. But you want to make sure that you have enough hand sanitizer in, that you are getting all aspects of your hands, not just, like this. You want to make sure that you are doing in between your fingers, in your fingernails, and your thumbs, the tops and the bottoms of your hands. And you want to make sure that once you've put the hand sanitizer on, that they are dry. Okay? So what about personal protective equipment? There is more things than just gloves that we can use to protect ourselves. We have gloves, we have face masks, gowns, we have goggles, face shields, for our shoes. Anything else that you could think of?
That cap.
The cap, okay. When would you need to wear all of that, Desiree?
Surgery.
Surgery, okay, very good. Okay, so hand washing and gloves. So part of your assignment is going to be related to this. Okay, I want you all to become familiar with the 4 steps of thorough hand washing. Thorough hand washing. I will send you a video. You need to make sure that you're washing your whole hand, in between your fingers, your palm, your fingertips, underneath your fingernails, your thumbs, the tops of your hand, even around the tops of your wrist. Okay. So gloves. Tell me the 2 types of gloves that we wear.
Sterile, non-sterile.
Sterile and non-sterile. Are you able to identify the difference? Okay. So I have with me of clean gloves. Those are my clean gloves. And these are my sterile gloves. Sterile gloves come in a sterile package. Is there a correct way to put gloves on and take gloves off?
Yes.
Yes. Okay. So first I want to demonstrate your regular gloves. Now these are you would wear for patient care, injection, medication administration, venipuncture, anything that does not require sterile technique. So because these are not sterile, it doesn't matter how I put them on, but it does matter how I take them off. Okay. So you're putting your, I'm going to put my gloves on. Both hands. So after I have provided my patient care, there is a technique that you need to use to prevent the spread of infection when taking your gloves off. You don't want to use one hand. You don't want to touch anything that's not gloved, because what's that is going to do is whatever infection or contamination that you have on this hand is coming in contact with your skin. Okay, so to take off non-sterile gloves, you want to, if you can, pull the fingertips off like this, okay? Grab the glove and pull it off. It will be then in a little ball. Then you are going to ball that up into the other hand. Your hand that you have already removed the glove from, you're going to simply come over and put your finger up underneath the rim of your glove and pull it gently over like that. Everything is in one piece. Now this is the part that was against your skin, and the part that was contaminated is all inside there, and then you simply throw this into the trash. You never want to put your dirty gloves on a countertop, the floor. If you have a injection station, go ahead and dispose of these in the trash as soon as you take them off. If they have blood, if they have wound drainage on there, any type of body fluids, you want to put these in the biohazard container, not the regular trash can, not the sharps container, but your biohazard container. What's the difference?
One's just for needles and the other one's for hazardous materials.
Exactly. There should be 2 red containers in your exam rooms at all times. One is your sharps container that's going to be locked in a secure area, and the other is your biohazard container for blood, body products. If you do a feces card, any of that is related to bodily fluids will go into that biohazard container. Now, your sterile gloves. Your sterile gloves come in a package. It is sealed. Your gloves are going to be in there. Okay. Very good. I know that some of my new students did not get a pack of the sterile gloves before leaving the classroom. That's okay. I'm going to show you a different way that I want you to practice with a pair of socks. Okay. So there is a proper way to open these, and you must put these on in a sterile fashion. Okay. When would you need to use sterile gloves? Surgery, minor procedures, stitches, sometimes even some wound cleansing, depending on the wound and the treatment of the wound, that would need sterile gloves. So I'm going to see if I can move the angle of my camera down so slightly so that you can see, or I'll do it right here in my hand. So what you need to keep in mind is with sterile gloves, they need to be on a flat surface. Once you open this package, they are no longer sterile. So you can't open them, and if you don't use them, save them for later. That's it. They need to be thrown away. So there are tabs. You open your gloves. You pull the gloves out. They're going to be in sterilized paper. They have directions. This is the size. This is a small. And then it has cuff end. Cuff end is going to be the area that goes around your wrist. So you want to lay them on a flat surface. You're going to open them up. Then it's going to have for you right hand, left hand. Okay. So that's how you lay your package out in front of you. Right hand, left hand. Okay. So I have it on a flat surface. Kind of like opening, like if you bake a piece of fish in tin foil, how you wrap it in the tin foil and you have to open it up in certain sections. So these actually have arrows on them, and you are going to simply follow the directions of how to open the package. Once I open the package, I'm going to hold the gloves up for you so that you can see how to accurately put them on. So I've opened it up a little bit more. You see that there's flaps of paper right there? Those are the flaps of paper that I'm going to grab to be able to open my package without contaminating the gloves. So my gloves are open just like this. They are placed face down on my flat surface. So you can choose whichever hand you want to put on first. So when you open your gloves, they are slightly folded up. You see the fold, Lois?
Yeah, yes, I haven't opened it, but I know what they look like.
Okay, so I'm gonna hold it up for you, you lady,
Okay.
that you can see what they look like while they're folded. I am going to put my right hand on first because I am right hand dominant. So if you will notice, I'm gonna hold it up for you. See how they are folded down? Okay, so I do not want to, this is the only part that I can touch, is the folded down part, because this is what's going to touch my skin, not any part of the glove. If you touch any part of the glove, you are contaminating that glove. Okay, so only touching the rim, I call it, okay, the folded down part of the glove. I am going to put I'm going to hold it open with my other hand, and I'm simply going to put my fingers and you just slide it up. So now see how it is crinkled? Okay. I'm just going to gently pull down, still only touching the part that was folded up. So this hand is sterile. This hand is not. Remember, which part of the glove is sterile in my package? So now with this one, what I'm going to do is take these fingers of this hand. So with this hand, I picked it up like this. Once you have a glove on and this hand is sterile, you cannot touch that part with this sterile glove. How I'm going to pick it up is different. You're going to simply place these fingers up underneath the cuff to pick it up. And I'm going to show you. I'm going to pick it up and show you. So, and keep your thumb pulled back because you don't want your thumb. So rule of thumb is keep your thumb always out of the way. So I'm going to gently, this is how you pick it up. Okay. So I'm not touching the part that's going to go on my hand. I'm only touching the part that's going to go on top of my hand. So this is still sterile. Then you simply, these are a little stuck together. Okay, I've got it open. See? So then I'm going to slip my hand in the glove. And it's okay. See how my fingers are not working? It's okay. I've only still touched the sterile part. I've got it pulled up. Once you get your glove over your hand, then you can go back and redo your fingers on your glove. Because remember, this was still sterile, this was still sterile. Then you can fix your glove. You can pull them all the way on your hand. The important thing is, where are you touching it on the cuff part? You don't want to touch anything that's touching the skin because those will contaminate. So if you're going into a sterile area, or if you need to be sterile, if you happen to put your gloves on one side of the exam room and you have to walk to the other side of the exam room to assist with your procedure, you have your gloves on, you've washed them, you've dried them, you've put your sterile gloves on, you can simply fold your hands like this to walk to the area that you need to go in. Don't be touching anything. Don't touch your face mask. Don't touch anything. Keep your hands together. Go to the area to do your procedure, and then you can take them off. Okay? So even if you have a face mask on, you can't readjust your face mask with your sterile gloves on. Same thing of taking them off. Okay? They're contaminated. They have blood on them. Same thing. Grab them from the inside, pull down, ball it up in one hand, under the cuff, pull off. Now, everything is contained in there, and they go into the biohazard bin. All right, so for those of you that don't have gloves at home, if you don't have sterile gloves, but you have regular gloves, I want you to get a piece of paper, a piece of leaf paper, and fold it up into a half, and place your gloves face down in there like they are sterile gloves. I want you to practice being able to put on sterile gloves, taking them off correctly. Now this is sterile, not regular. I'm going to show you with a pair of socks if you don't have gloves, okay? So I have a pair of my husband's plain old white socks. I know that there's no fingers in the sock, but what you can do is you can still get, and this is a tube sock, you can fold the sock down just like a glove was folded down in my sterile pack, okay? I can still, I'm going to show you, I'm going to put them on my flat surface. Still put them on using sterile technique, even though that these are not sterile. Scenario, I've opened my pack, one glove, one sock by the cuff. I will put my hand in there, okay? And then I'm going to pull my cuff down. So here's my hand. I know it doesn't have fingers cut in there, but we're improvising because we don't all have gloves. So same scenario. I'm going to grab under the cuff of the sock and keeping your thumb pulled back. That's the hard part. That's going to take practice. So keeping your thumb out of the way. So this is a little more challenging. So then I'm just going to slip my hand in there and pull it back. There you have it. The important thing is keep your thumbs out of the way and not touch the part of the gloves that need to remain sterile. Okay, so that is your lab assignment. Practice it a few times. I want you to do a video. If you have gloves, use gloves. If you do not have gloves, use tube socks, improvise. You must record a video of how to properly put on sterile gloves and how to properly remove them. That's one assignment. Your second assignment is to perform a video of proper hand washing, including all areas of your hands. Those are your two assignments for today. It is a homework and a lab assignment combined. Any questions?
So the assignment is the gloves and what else?
Hand washing.
Oh, okay.
Proper hand washing. Look in your textbook of the proper hand washing techniques. Okay. So proper hand washing video and sterile glove video. How to put them on and how to take them off.
The
Do you want that submitted through the assignment tab?
You can do, if you need to do the video, and you can you, upload it to the post on Edmodo in the comments section.
Comments.
Yeah, put it in that section.
in the comments.
Yes.
Okay.
Yeah.
You said something about folding the paper or something in half. If you have like the regular disposable gloves.
Yeah. If you don't have gloves and you're using socks to improvise, just get you a plain white sheet of paper, okay? And just simply fold it over in half and then
Okay.
fold it again. So that way you can practice on how to open the paper correctly with your sterile gloves inside.
Okay. Do you want this by a certain time? I probably won't have anybody to take a video until just to
Okay, that's
midnight.
fine. Do it whenever you can. If you don't have gloves, what about a pair of winter gloves? Use that. Okay. So whatever you have at home, you can use socks, you can use any type of gloves, but the important thing that I want you to get out of this is keep in mind that they are sterile gloves, and I want you to be able to put them on correctly and take them off correctly. That's the main point that I want you to remember and to focus on. Any questions? Comments, concerns? Y'all ought to keep up the great work. Yes, ma'am.
Okay, I just found that envelope saying about like the period mark, quarter mark, half mark, whatever. Do I just wait to talk to one of the directors about that? That yellow envelope with the when you made like just
When we
wait.
go back. Yes.
Okay,
Yes.
I just didn't want to not do it.
Yeah. No, it's okay. When we'll go back.
Okay.
Okay. Well, you all ladies have a wonderful rest of your day. Thank you so much for joining, and I'm here if you need me. Just reach out to me and keep up the wonderful work. All of you ladies are doing a great job. And I will speak to y'all again later.
Have a good day.
Bye. Y'all too.
Bye.
Give baby a hug for me. Desiree. She's gone. Bye, ladies.
Bye.